welcome to Mature Matters. My name is Debbie Clark and I'll be your host for today. We have a very special guest today and we are going to be talking about depression. You know, it's pretty common to be sad or blue on some days, especially like a day today that's cloudy. But if those days turn into weeks or months, it probably would be a good idea to explore if you are suffering from depression. Our specialist, Sharon Jones, is going to enlighten us on this subject. Welcome, Sharon.
Thank you.
How are you today?
I'm doing very well, thank you.
Good. Sharon is a licensed psychologist, and she's also the clinical director at the Seniors Wellness Group of Michigan. How interesting. Can you let us know a little bit about your background?
Well, as you mentioned, I'm clinical director of Seniors Wellness Group. I've been with this group practice for at least 18 years, and we are a multi-specialty practice that specializes in providing mental health services, psychiatric and psychological, to older adults, especially those residing in long-term care facilities or rehab facilities.
I see. Wow, very interesting. I think the big question is, what is depression?
Well, as you mentioned in the opening, it's very common to feel sad or blue on some days, but when the sadness lasts for a period of days or weeks and drags on, then it gets into what may be a clinical depression. So we look at depression as a condition that you see in adults, but particularly at this point we're talking about depression in older adults, and we're looking at depression in those 60 or 65 and above.
I see. When there is depression, or if you think there could be depression going on, how would a person address that?
Well, you know, typically you might see something that causes you concern. You'll see a change in personality, maybe a change in behavior, somebody who's normally very socially active, involved with their friends, maybe community activities. You'll see that they may be less interested in participating in some activities. They might decline invitations to go out and socialize. You find that they're more withdrawn or socially isolated. When you see something that causes you concern like that, then you'd want to perhaps, inquire, find out what's going on with them. Ask them if there's any particular reason why they are not doing some of the things that they've previously enjoyed and have been active and involved in.
What things could trigger a depression? What events?
Well, there are lots of things that might trigger depression. We tend to think of losses, changes in life circumstances. As we get older, obviously the losses begin to pile up. There are losses in terms of people that we care about,
Sure.
there are bereavement issues,
Sure.
there are losses in abilities, perhaps physical functioning. You're not able to move or to get around as easily as you used to before. There are changes in sensory abilities. Maybe you're not able to see as well. That might impact on some of the activities that you previously enjoyed, say like needlework or crochet, that you're no longer able to kind of participate in those activities. There can be losses in terms of income. As people retire, that can be a very significant triggering event for some individuals, the change in life roles. There are also changes or losses in terms of just your perceived ability to be kind of as active as you used to be.
If a person is depressed, can they show signs of memory loss?
Absolutely. In fact, memory loss can be one of the first indications that there is a problem. But of course, in this population, older adults, we tend to worry when we see cognitive changes, memory loss, changes in our thinking. People worry about dementia. And the memory loss that we see tends to look a little different with dementia than it does with depression. For instance, it might be a slower kind of onset, more gradual with dementia, as opposed to a more rapid kind of onset with depression.
I see. This topic is a little near and dear to my heart because my father has suffered from depression for many years, but they had a change of event like you mentioned, and he was showing significant memory loss. we did take him to a neurologist, and he explained, there were additional tests. So if a person is noticing these types of symptoms, what should they do?
Well, you actually did what we would highly recommend that people do, and that's the first is get a medical checkup. You might not start with a neurologist, for instance, but it's really important because one of the other potential triggering factors for depression can be changes in physical functioning, physical conditions. They can bring on what mimics depression, the loss of energy, the changes in appetite, and sleep disturbance. So if you see symptoms like that, the first thing that we'd recommend is that you really get a good checkup with your primary care physician. And in some instances, it may be necessary to go on to other specialists, such as the neurologist, as you did with your father. So.
How successful is treatment once a person is diagnosed with depression?
Fortunately, although depression is very common, it also is something that we can be quite successful in treating. Psychotherapy or supportive counseling with an individual, especially one trained in working with older adults. And by that I would say someone who is going to appreciate some of the chronic health conditions that also can contribute to some of the problems. Supportive counseling with a trained individual can be very effective. Sometimes in instances, particularly when we see a lot of physical symptoms, the energy level, the changes in appetite and sleep, or perhaps more serious symptoms such as recurring thoughts of death, or perhaps even suicidal ideation, thoughts about suicide. Those symptoms may require medication, and so an evaluation by a geriatric psychiatrist would be very helpful and beneficial. And the combination oftentimes of psychotherapy or supportive counseling along with an antidepressant has been shown to be very effective.
Right. And if a person gets on this type of treatment, is exercise important?
Absolutely. Exercise is good for so many reasons, but individuals who stay active can ward off symptoms of depression. But also it can help in the recovery from depression just to get up and be more active and moving to whatever level that you're able to do. Chair exercises can be very effective if you have limited mobility as well.
Right. Very interesting. What can we take away from this presentation that would be most helpful for our viewers?
I think the most important thing is if you do see changes in a loved one's condition, perhaps in their activity level, someone seems more irritable than usual or is complaining of memory problems, then you'd want to talk with them. Try and find out what's going on. Encourage a checkup if they haven't had one recently, or even if they've had. Sudden changes in physical functioning can bring on some signs of depression. Get that physical checkup to make sure that everything is okay there. There are lots of medications that we treat for conditions, chronic physical conditions that can mimic that. So we'd want to make sure that that's been ruled out. And if necessary, then seek assistance with supportive psychotherapy with a trained professional.
Sounds good. Well, Sharon, you've given us some very valuable information. And if any of you are suffering from any of these symptoms, don't be afraid to go and get help. As she said, go see your primary care physician. Express to your family your sad feelings. I think a lot of us don't want to admit that we're depressed. And those in the older population, I know even with my father, you think I'm crazy. No, it's a true physical diagnosis.
Absolutely. That's a really important point that you brought up, because so many people feel very uncomfortable about the thought, particularly in that generation. Yes. It wasn't something that you talked about, but if you talk with them about, you don't feel yourself, and we would do something if you had a heart condition or if your sugars were off. This is something that can be treated and you need to go. Doesn't mean that you're crazy.
Right.
Absolutely.
Well, thank you so much, Sharon. We truly appreciate you coming on your work day and letting us know about this very good topic, good information. And at this time, we thank you so much for tuning in, and please come back again and have a great day.